What we know is we've got an ageing population that is increasingly unhealthy with rising levels of obesity and diabetes. And we don't even seem to have cracked smoking either. And all of those conditions, all of those lifestyle choices will have an impact on people's eyesight. So I think we are looking at the numbers of blind or partially sighted people significantly expanding over the coming decades.
Pressure on eye health care services is not a new topic. It is becoming an increasing problem. Services are overstretched, with 10% of all patients who attend a hospital will be coming to the eye department, and there's been a 40% increase in this demand over the last decade. This is something that is just going to grow, and what we need to do is make sure that in order that all the people who require help get it, we need to make sure that we continue to improve and work together to make sure that the resources are available to do that.
And there has never been a more pressing need to transition away from reliance on traditional service funding and delivery models. They are not succeeding anymore.
We hear every day about preventative treatments and preventative actions and lifestyles that we can all adopt. But of course that means almost parallel funding, the prevention at the same time that we that we fund treatment. And so we're looking at a generation of parallel funding, and nobody seems to have the resources to really make a difference in the public health prevention place. But that is where the big wins are.
Science and technology are undoubtedly our future. The developments involved there will not only be involved in preventing eye disease, but for treating it, and also to make sure that people are appropriately rehabilitated. This is something that is very exciting and has already made enormous changes to the way we work.
There is so much new technology out there. There are so many new ways for blind and partially sighted people to manage their lives. There are so many new ways for clinicians to treat people with sight loss conditions.
So yes, things are improving, but that comes at a price. These things all cost money, they take resource, they take personnel.
And of course there's no more money, is there? There's no more money in the NHS, there's no more money in the social care budgets. And in fact we're seeing those under huge pressure at the moment.
To move on, we need to innovate. We need to share ideas, pool our creative thinking.
What has worked well for us as a sector is collaboration, and we need to continue on that path. By working together with the creativity and enthusiasm that is the hallmark of our sector, we can cross traditional boundaries. We can achieve far more than if we simply all work alone. The UK Vision Strategy is a coalition and it's held together really well for the last 8 years. The job in hand is to make sure that it stays a strong coalition into the future, and that's not easy because there are huge pressures on everybody's time.
We've got to make sure our alliance across eye health and sight loss stays strong, but also reach out to other areas that have resources, that have people.
I know that we're stronger together as a sector than we are when we're divided. And do you know why we need to be strong as a sector? We need to be strong so that we can support as many blind or partially sighted people and those at risk of sight loss as humanly possible.